the premise is working as a pharmacy technician, and this is especially prominent in the community setting because you're interacting directly with these patients every day. You're going to have patients coming in that are on controlled substances chronically. So the example that I'll provide in the context of this slide is opiates. So narcotic pain relievers, these are drugs like oxycodone and morphine, etc. These are very powerful analgesics, so pain relieving medications that some people really need to adequately manage their pain. And this is especially true for patients with chronic conditions, cancer, where the use of other non-narcotic pain relievers has been insufficient. And many of these patients will be on opioid analgesics chronically, not to treat the pain to the point where they're not experiencing any pain, but just to the point where they are feeling just barely well enough to get through the day. So what I'm trying to convey is you're going to have patients that you have to continuously advocate for because they genuinely need these medications to have any semblance of a quality of life due to their pain conditions. Now, on the flip side of this, most of you are probably familiar with the opioid epidemic. So this is something that's become very, very prominent over the past couple of decades, especially this most recent decade, due to a multitude of factors, primarily the highly addictive nature of these substances, where there's been widespread misuse of opioids, and this has resulted in severe health outcomes, from substance use disorders to overdoses and accidental deaths, etc., from these products. So working in a pharmacy, you're going to encounter this issue all the time, where your primary goal is to advocate for the patient and ensure they're getting the treatments they need in the safest way possible. Yet you're also burdened with some level of compliance responsibility due to these federal regulations around controlled substances. And there's going to be scenarios where you're encountering patients that have substance use disorder or who may be diverting controlled substances, and you're going to need to understand what to do if you suspect something like that is occurring. And you're going to have to approach this in a way where you're not putting the patients that are genuinely using these products at risk of being mislabeled.